Hello everyone, and wherever you are in the world right now, thank you for joining us. I'm Margot, the IOSH Research Manager at IOSH, and I'd like to welcome you to today's webinar. We are delighted to have Doctors Margot Joosen, Evelyn Brouwers and Jo Yarker with us today. If we start with Margot, please share your video, Margot. Margot is a health scientist and holds a PhD in occupational medicine. She currently works as a senior researcher at Tilburg University in the Netherlands. Her research focuses on mental health at work and sustainable employability of workers with health complaints such as mental disorders, cancer survivors, and complex health problems. We also have Evelyn. Please share your video, Evelyn. Evelyn is a professor of mental health and sustainable employment and is also at Tilburg University. She has a background in psychology at the University of Leiden and the London School of Economics. And last but by no means the least, we have Jo. Please, thank you, Jo, for sharing your video with us. Jo is an occupational psychologist specialising in work, health and well-being. Jo is a director at Affinity, Director of Affinity Health at Work, and leads the professional doctorate in organisational psychology in Birkbeck, University of London. So what we're going to be doing is we're going to be sharing a series of pre-recorded, very interesting presentations. And after each presentation, we're going to have a live Q&A session. And then once we've completed all the presentations, we'll then also open it up for a period of time where we can open it up again for questions and answers with the whole panel together. So without any further ado, let's start with Margot's first presentation that will be looking at return to work trajectories for employees returning to work following mental health absence. Let's have Margot's first presentation.
Hello, my name is Margot Joosen. I'm a senior researcher at Tilburg University. And today I want to share our results of our project, Gradual Return to Work Trajectories among Employees with Mental Health Problems. So this project was financed by IOSH, and I'm the project leader of this project. I'm presenting on behalf of Maita Spronk, who was the primary researcher on this project. So in this research, we focus on gradual return to work arrangements. And with gradual return to work, we mean that employees resume their work step by step after a period of sickness absence until they fully return to work. So what we know from research is that gradually returning to work is one of the promising components of a successful return to work interventions. We also see that in research, the focus is mainly on return to work itself. So is someone back at job, yes or no? But there's little known about the research process. We do know that this process is very complex and multifactorial. So we wanted to learn more about that. So return to work, gradual return to work arrangements are increasingly common in various European countries, sometimes also systematically recorded. So we have more and more data on gradual return to work. So this made us wonder, and we wanted to know, so are there beneficial or less beneficial gradual return to work trajectories as it comes to sustainable work resumption? So we had three objectives in this study. So first, we wanted to investigate which trajectories of return to work can be identified among employees with mental health problems. We wanted to provide a description on the different trajectories, and we had data on some demographics, personal and work characteristics. And we wanted to assess the implications of our results for practice. So first, we collaborated with an occupational health service, one of the largest in the Netherlands. So this project was conducted in the Dutch system. And we used retrospective longitudinal absence data. And we had access to data of about 9,500 employees. So this is actually a big database. We used latent class transition analysis. And this is actually a new and complex method in which we can identify different groups or classes based on the variables that we put into the model. So we try to identify different groups of return to work trajectories, and we also wanted to see if there are differences between these trajectories in sustainable work resumption. So after that, we conducted a multi-stakeholder meeting to reflect on these results. And we use different stakeholders that are involved in the return to work process, such as occupational health physicians, social workers, employers, HR managers, and also people with lived experiences participated in this meeting. So what did we find? First of all, we found 5 distinct trajectories. We could identify those in our database. And these trajectories, they differed in return to work duration. So we had fast or slow return to work trajectories, and in relapse occurrence. So small or larger chance of relapse in between this, in this process. So I will show you now these 5 trajectories, and here we have them. So here we see one example of a trajectory, and this is actually the time in months, so 12, this is 2 years, and here we see the return to work percentage. So here 0 is someone who's on sick leave, and 100 means 100% back at work. So here we see class 1, and this is one example of an employee that could be identified in this class. And this is actually fast return to work without relapse. You see here that this person is on sick leave, then returns to work for 50% of their contract hours, and then increases the hours till 80%, 90% until they fully return to work. Here we have an example of class 2, which is a trajectory with slower return to work. It takes longer to return to work, but again, there is no relapse. And here we have class 3. This is, again, a fast return to work, but here we see there is a relapse. So this person is on sick leave, returns to work for 90% of the working hours, but then there is a relapse and falls back on sick leave, and then again, step by step increasing the hours until 100%. So here's class 4. This is again a slow return to work, but with relapse. And the final class, class 5, this is a very fast return to work, but no relapse. And then here in the right bottom, we see the percentage of the total sample size. So here we see that class 1 is the biggest class, and then class 2, 3, and 4. So what we also want to know is to see if there are any differences in characteristics between these classes. So what we found, looking at age, we saw that their average age was lower in the faster trajectories. We also saw that there were more men in class 5, in the fastest trajectory. When looking at more personal characteristics, we saw that there were more stress-related complaints and people with adjustment disorders in the faster trajectories, and more people with burnout and mood disorders in the slower trajectories. We also had access to some job characteristics. So here we found that there were no significant differences regarding working hours per week, so no differences between part-time or full-time work. We saw that there were more employees from the profit sector and larger organizations in the faster trajectories. And then finally, we looked at the differences between these trajectories on sustainable work resumption. And here we found no differences between these 5 trajectories on sustainable work resumption in the 2 years following full return to work. So from our data, we cannot say that there is one beneficial trajectory for sustainable work resumption. So we also had a multi-stakeholder group with different stakeholders involved in the return to work process. And so first of all, these stakeholders, they recognized all of these trajectories. So it's important that what we found in the data was actually also recognized in practice. So in the data, we saw that there were mostly differences between the faster trajectories and the slow trajectories, and we did not find any differences between the trajectories without relapse and with relapse. So we discussed this with the stakeholders, and they mentioned various possible causes, but particularly they mentioned, well, this might be caused by suboptimal communication between the employee and the manager, but also communication between different healthcare providers and occupational health professionals. Also, they mentioned stigma or self-stigma as possible cause. It might be that negative attitudes from a manager or from co-workers can cause extra stress and might, therefore, an employee might relapse. So we also talked about possible, how can problematic trajectories be prevented. So again, they mentioned that a supportive communication and aligning advice and guidance from health providers is important, that destigmatization at the workplace is also important. They also mentioned one other aspect, and that is providing hope and perspective to the employee. This was specifically mentioned by the people with lived experience, and they mentioned we should pay more attention to what people are able to do and focus on the positive. So that providers of healthcare providers should provide hope and perspective for the future. And this would increase the motivation of the employee for their recovery and return to work process. So in conclusion, from this research, we found and identified 5 distinct return to work trajectories, varying on return to work duration and relapse occurrence. We saw large individual variability and differences between personal, medical, and work characteristics. And these differences, they occurred specifically between the slower and the faster trajectories and were not so much related to the relapse. So what can we learn from this research for practice? So we think that this actually provides insight into what normal return to work trajectories are for employees with mental health problems. So when you look at these 5 trajectories, you see that there is no one size fits all. There is large variability. And when you would show these different kinds of paths to return to work, it might increase the awareness among occupational health professionals and also employees that there is large variability in this process. We also think it can help to develop personalized return to work interventions and tailored interventions to specific individuals and organizations are very much needed. And both from our absence data and the suggestions of the stakeholders, we think that we should focus more on social aspects such as communication. Also, we think that this shows that we need more focus on the process of return to work and not only on the start of the return to work, because after that relapse can occur. As for research, it might be very interesting to work together with occupational health services and the data that they recorded more intensively. It is needed then that these data are recorded more systematically, but then it can really provide a rich data set and can provide us with valuable insight to improve return to work support. So thank you very much for your attention, and I also want to thank the project team and collaborators, and also IOSH for supporting this project, and in particular Ivan Williams for his support during this project. Thank you very much.
Okay, so that was an excellent presentation. Thanks to Margot. I'm not seeing any questions at this point, but I would like to ask Margot, since she's joined us, just one question, really just to inform those who are watching. You mentioned that there were stakeholder group. Who were the roles, who were involved, the professionals in that stakeholder focus group?
Yeah, we had different members involved, different stakeholders. So we had an occupational health physician. Let me check here, so I say correctly. We have a case manager who was dealing with the process and return to work. We had a social worker, an occupational social worker involved, an employer, HR manager, psychologists, and we had also people with lived experience, so people with mental health problems.
Brilliant, thank you. And we've got one question that's come in from Judith. Thank you, Judith. What percentage of organisations offered gradual return?
Yeah, I understand this question, but actually we don't really have we don't have knowledge of that in this data set. So unfortunately, I cannot answer that question. But yeah, it would also be interesting to know this.
Okay, and then I guess linked to that, that was a really rich data set. Actually, there was almost 10,000. How come, and is this to do with the Dutch system? You know, how were you able to take advantage of such a large data set?
Yes, I think it is about, that's with the Dutch system. So in the Netherlands, every employee has access to an occupational health physician. So occupational health services, they are involved in the return to work process, in the treatment and guidance of workers who are on sick leave. And from the first day of sick leave of an employee, so the occupational health service records all kind of data with regard to their return to work. So, so we teamed up with one of the largest occupational health services in the Netherlands, Human Total Care, and so we joined, and then we could have access to this large number of data.
Okay.
To say it's still challenging to get access to this data, which is really useful for doing research, because of course the purpose of recording this data is not to do research with, it is to record the process of the employees.
Okay, thank you. And we've got a couple more questions, if we can try and squeeze them in. So one is from Keys, and they've asked, was information available about the previous or any previous shorter spells of absenteeism within that data set?
Yeah, and thank you, Kees. Thank you for this question. Well, with this data set, we had access to all types of absenteeism, but we could not really link shorter absenteeisms to the next period of absence within one person. So that's actually, I think, also a limitation, of course, with this data set, that we can follow a person through their process of absence, but we cannot really see if this particular person has other absentee spells before.
Okay, and then another one from Holly is, how far do employers' responsibilities go? So is there a point where we're unable to help an employee any further? What's your thoughts on that?
Well, this is also has to do with a Dutch system, where I think there are differences in responsibilities for the employer. So in the Netherlands, the employer has a responsibility of 2 years to take care of his employee who's on sick leave. So for 2 years, both parties, so both the employee and employer, has to put effort in recovery and return to work. So for the Netherlands, at least for 2 years.
Okay, thanks, Margot. I think we'll leave it there at the moment in terms of questions, and come back to any others at the end. So if we can move to the next presentation, which will be delivered by Evelyn, in which she looks at the question to disclose or not to disclose your mental health problem in the workplace. So let's have Evelyn's presentation, please.
Hello everyone, my name is Evelyn Bouwers. I am an endowed professor at Tilburg University in the Netherlands, and I have a research chair which is entitled Mental Health and Sustainable Employment, and I'm excited to be sharing today with you some interesting findings of our study on disclosure of mental health issues and illness in the work environment. And I'll now change screens so you can see my slides. All right, so this is the original paper. It's been published in the Journal of Occupational Rehabilitation. If you find it interesting and you want to learn more about my presentation, then you can look it up on the internet for free. And what we studied in this paper was actually two research questions. The first was, what are actually advantages and disadvantages for the worker of disclosure in the work environment? And the second one was, what factors are actually of influence on a good outcome, because the disclosure decision is complex. What we did is we held focus group interviews, 2-hour focus groups with a variety of stakeholders. We interviewed people with mental health problems, but also mental health advocates, employers, HR managers, human resource managers, and reintegration professionals such as occupational physicians and job coaches. So the first research question was on advantages and disadvantages. Now we found 4 advantages and 2 disadvantages. We found that disclosure, according to all the stakeholder groups, disclosure can lead to improved relationships at work. So people might appreciate it when you open up, or they might understand your behavior better, and that may lead to better relationships. Also, they said, if you disclose to a supervisor, he or she may be able to help you with workplace supports, such as temporary work adjustments, for instance. The third thing they said is, maybe if you open up, then you add to the creation of a more friendly and inclusive workplace atmosphere, because if other people see you disclose and that the others are reacting in a positive way, they might be more willing to disclose themselves in disclose more personal information, and that might sort of add to a better workplace atmosphere. And the fourth advantage that we found was that people said it is nice to be, it's not nice, but it's essential to be your true self at work. And so especially people with mental health issues said, on the fact that I didn't have to pretend anymore, that I could just say, I don't feel good, this is why I'm not coming to the event, rather than make up some excuse. So authenticity is an important advantage of disclosure. We found 2 disadvantages, so fewer disadvantages, but perhaps with more impact on sustainable employment. We found discrimination and stigma to be big disadvantages. Discrimination refers to actual behavior, such as job loss, not being hired, and stigma refers to how you are being seen by others, being labeled by others. For instance, we found an employer said, if you disclose during the hiring period, I think that's a no-go. And the employer will say, thank you very much for warning us. In other words, we're not going to hire you. And a human resource manager said, well, the moment I hear a mental health condition during a job interview, it is stored in my memory. And after that, the job applicant can talk all he wants, but I have already heard it. So we found, for research question number 2, we found 4 themes of factors that are of influence on whether or not the disclosure is going to be successful. First, there were workplace factors. So we found that low responsibility level was probably going to lead to a better outcome. For instance, they said if a cleaner discloses, it's probably going to be receive better responses than if, like, the neurosurgeon or the pilot is going to disclose. They also said the workplace climate is of influence. So if you have a good atmosphere, then probably the reaction is going to be more positive. And the type of industry, they said in a more masculine or macho culture, influence might not, the outcome of disclosure might not be as positive as it could be in more social in types of industries. For instance, it might be different for the military versus healthcare. So a second factor of influence was was financial. So they said probably if the economy is doing well, disclosure will have better outcomes, and also if the financial risks are reduced for employers, for instance, by financial incentives by the government, then probably that will lead to better disclosure outcomes. Then we found employee factors to matter as well. They said, well, the type of mental health problem and also the whether or not it has a high number of severe symptoms or whether there's low symptom severity, these things matter. For instance, they expected that burnout syndrome or autism will lead to, a disclosure of these types of disorders will lead to better outcome than, for instance, more heavily stigmatized conditions such as schizophrenia or substance use disorder. And also they said high self-esteem versus low self-esteem and communication skills, negotiation skills even, these matter as well. If you can disclose with confidence and say what you need, that will lead to better outcome than if you're like more insecure and so on. Right, and the fourth factor that was of influence on a good outcome was the disclosure process itself. So questions like, to whom do you disclose, when, what style do you use, in what way, what is the content of your message, and how well do you prepare your message? These things, and these things are very important. This is the most exciting finding about of our study, because these are the only things that people influence themselves. So the economy, for instance, is something that a disclosure cannot influence, but the preparation of disclosure itself, yes, they can and can therefore influence their own disclosure success. So what we found is it is important that you think about who you disclose to. So some people say, I'm an open book. Everybody can know, but is allowed to know that I have this and that. But maybe it's wiser to just be selective and think, okay, who can I trust and disclose to, or who can help me? Also, they said the timing is important. So they said the outcome will probably be better if you don't disclose during the hiring period, but first build up a relationship with the employer. The way to disclose also, there are many different ways to disclose. You can just, have a PowerPoint presentation for the entire company, or just disclose to your one person, the coworker, or there are lots of ways the disclosure can take place, and these matter as well. What also matters is the content of the disclosure message. So in other words, do you say, this is my medical diagnosis and this is all the trouble that I went through in the past? Or do you say, okay, without mentioning the medical diagnosis, you say, okay, I work best if I'm in a quiet environment, or so future oriented and less medically oriented disclosure was esteemed to lead to better outcome. And also they said the tone or the style in which you disclose is important. So there are people who say like, okay, this is my disorder and now you as an employer deal with it. That is not going to lead to a successful outcome as much as when you say, okay, this is what I have, or this is what I'm dealing with, and maybe you can help me, and this is what you can do, and this is what I can do. Now we have made an infographic of all these tips, and this infographic you see on the right is available if you want to, for free. We want to help people and promote sustainable employment. So if you are interested, please contact IOSH or contact me, and you will be allowed to use it and distribute it further. Right, so to sum up, there are advantages, but there are also severe disadvantages to disclosure. And we cannot say that there's one size fits all answer or advice that we can give. So it really, whether or not disclosure is going to be a success heavily depends on the situation, on the people involved, and so on. We found in the study that most factors cannot be influenced by the disclosure themselves. However, there are some very important factors that can be of influence, and so therefore we developed the infographic. Right. Thank you very much for listening. This is all for now. Bye bye.
That was a really interesting presentation. I mean, disclosure is something that's really tricky and very sensitive, I would imagine. So while I give you, the audience, to send in your questions if you have any, Evelyn, can I just ask? So one of the things you mentioned about was timing, and you specifically mentioned as an example hiring. During the hiring process, perhaps that may not be the best time to disclose. Have you got any thoughts in terms of other situations? So, for example, I'm aware of individuals who, they work for a private company and, they're about to go through a merger or some sort of restructuring, and they've experienced a lot of burnout and they don't feel ready to come back to work. So what's your thoughts in terms of disclosure in that situation?
Right, thank you very much. Well, first of all, I want to apologize because viewing the video, I saw that I talked too quickly and sometimes a little bit of what I said was lost. So I'll try to speak a little calmer now, and I hope that everybody can understand. Well, one thing that our study showed was that there is no one size fits all answer for anyone. So it's always a matter of really, so the advice basically is that one should always take this as a serious decision and prepare. And one of the findings was that if people said, if it doesn't affect your workability, if it does not affect your work, then it's probably wise not to say anything, or work or well-being. If you don't experience stress, if there's no real need to tell, it's probably safer not to tell. We do see in other research, which has not been published yet, but that we're still working on right now, that being on a temporary contract might put you at an additional risk of not getting your contract renewed. And actually that's what we found in this study as well, where especially the HR managers, but also the others said that that is a serious risk that could happen. But again, there's also employers and human resource personnel that you are open to an inclusive workplace. So also on that side, there's no one simple answer.
Sure, thank you. We have a question from Melanie. Thank you, Melanie. What about the legal aspects of this for employees and employers, for example, if employees don't disclose and later have a problem?
Yeah, good question. Generally, employers are not allowed to ask why somebody are not allowed to ask if you're ill, if you're sick. The employer is not allowed to ask what your illness is. They are allowed to ask questions about what you need in order to function well. I presume, but I have to be honest that I'm not sure. I presume that there are certain professions for which there's an exception, because then if there is a lot of risk involved, for instance. But I have to say I'm not sure about that.
Okay, all right, thank you, Evelyn. Before we move on, just to let you know, everyone, that the infographic that Evelyn mentioned, that's going to be available afterwards on the website. Okay, all right, let's move on to our next presentation. It's going to be focusing on evidence for work adjustments for mental health. So if we can have Jo's presentation next, please. Thank you.
Hi. In this session, I'm going to be talking about the evidence for work adjustments for mental health. When people return to work, it's commonly reported that they seek out or they achieve some form of work adjustment, but exactly what's going on is a little less clear. We were delighted to be commissioned by ACAS to answer 3 specific questions around this. So first of all, what's going on in practice? Second, what does the guidance recommend? And third, what is the evidence of the research out there? So we conducted a rapid evidence review We looked at a range of different sources, including the Cochrane database and also research reports that are published by UK stakeholder organisations such as IOSH, CIPD and others. And we looked at the quality of that evidence. So to the extent to which it described or gave an account of the work adjustment being put in place, or whether there was a pre and post evaluation, for example, of how effective that work adjustment was. We also looked at the guidance from stakeholder organisations to see what was being recommended and how employees and employers and those that were supporting them are guided through that implementation process. And we put all of that together into a synthesis and report. So first of all, what's going on in practice? So BITC indicated that 41% of employees experiencing mental health problems achieved no changes to their work. So that means a lot of people that are experiencing problems are not actually experiencing any adjustments to their work. When we look at the CIPD Health at Work survey, what we could see there was that 61% of organisations reported that a phased or a gradual return to work is the most commonly taken action in relation to mental health. So it does seem that organisations are taking some form of action, and certainly in terms of the way that work is staggered, if not having detail around how that work is staggered and what individuals are actually doing in that time as they return. It seems that managers are not necessarily supported in helping employees receive those adjustments. So again, the BITC survey showed that 8% of managers had received training on adjustments and rehabilitation. So some of the findings from our research have shown that managers sometimes don't know what to do for the best and don't know what they can implement to support returning employees. And given this lack of training and guidance, it's not surprising. It was also really encouraging to see in the Stevenson Pharma review that work adjustments are encouraged as a core standard. So in practice, we can see that much is going on, but there's no clear information really out there about what works for who in what circumstances. So we need a much more granular exploration of what's going on. When we looked at the guidance, we drew together 19 different pieces of guidance that were relevant to work adjustments in the workplace. And we drew from various sources. We asked experts and practitioners in the area to give us an insight into what guidance we should be including in our review. And we identified 19 different pieces of guidance, of which 6 were specifically focused on work adjustments, and 13 were more broadly around mental health at work, the management of mental health at work. 7 referred to the broad spectrum of mental health conditions, and yet there was only a light touch with no specific implications around which adjustments might be required or for how long for different conditions or different severity of conditions. We also saw that 4 was specific to return to work following absence, while 14 included at-work adjustments or simply identified that these were work adjustments that could be implemented. So again, that gives us a little indication that perhaps there's more information needed about how we can manage those work adjustments to really help those people who are trying to stay in work as well as those that are returning. In terms of who the guidance was directed at, 2 of the pieces of guidance were focused at the employee. So the employee off work or looking to return and sustain work. 9 were directed at the employer, 5 at the manager, and 2 were both for the employer and the employee, and 1 didn't specify. And all but 2 referred to the Equality Act and the legal obligation for employers to provide reasonable adjustments to those employees who met the criteria. So what's the evidence? We looked at the evidence, so it was a rapid review, not an in-depth systematic review, but it was systematic in its approach. And we also, as well as searching those databases, we went out to experts to ensure that we had the key pieces of research data included in our review. We identified 7 systematic reviews, 3 longitudinal studies, of which 1 was a controlled trial, 6 cross-sectional studies, 5 qualitative or interview studies, and 8 research reports. And we looked at those in depth to really understand what was the research that was conducted, what work adjustments were put in place, who were they put in place by and how, and what was the impact. And the key findings are quite interesting, I think, in that we know that employees perceive these adjustments to be effective. So employee reports in the interview studies, in the cross-sectional surveys, indicated that they found that their work adjustments were helpful, that they helped them sustain work. And certainly from employees that I've been privileged to interview for research, it's a common theme is that where work adjustments are afforded, employees feel empowered to sustain their work. What is less clear, however, is the evidence for effectiveness. So you can see here that there were very few over time studies, so very few longitudinal studies. And this means that it's not really that clear what impact over time these work adjustments are having for the individual, for the organisation. And notably, we found that very few studies have been conducted in the UK. So in the UK context, it's incredibly hard to gather return to work information, largely because of the way our absence data is managed. It's often managed within the organisation with no follow through to a wider national system. And so it can be very difficult to track absence over time. When we looked at the work adjustments that were being offered, we could see that they were broken down into these various themes. So adjustments to the work schedule, to the roles and responsibilities, to the work environment, policy changes, additional support and assistance provided, or redeployment to a different part of the organisation. And you can see at the bottom of that table, there are little stars. And so where there's 1 star, that indicates where the work or the benefits are described. So I think that it's having an impact. I feel that it's having a positive impact for me. Where research is indicated with 2 stars, that means that there's a cross-sectional association. So where people where people report that they have the work adjustment in place, they also report more effective return, more sustained return, and better job satisfaction and health. Where there are 3 stars, that's where we see a causal relationship. So where pre-measure, then an intervention in the form of a work adjustment, and then a change. And as you can see from the table, there was no over time causal relationship established in the research thus far. So what this tells us is that there's currently no evidence for the effectiveness of specific work adjustments. So longitudinal studies show mixed findings, while survey and interview studies suggest a range of adjustments are useful. So this lack of evidence doesn't mean that they don't work, it just means that we don't have any evidence at the moment that they are making a difference. So when we look more deeply into the evidence, we can see that there are a number of really important barriers and facilitators to consider. So those interventions that were multi-component, where they had multiple aspects to them, including line manager support, including a work adjustment and therapeutic components such as CBT, they were much more effective in terms of their perceptions from both those professionals that were supporting them and also the employee's experience. Encouraging disclosure is important. So those people who are more likely to access adjustments are those that disclose. But we recognise that stigma is still a concern. And this really talks to Evelyn's presentation about some of the common concerns that people face. Supervisor support is important, and we know that for so many things, but those who report support also report feeling safe and able to access adjustments. And co-worker support is important. Interestingly, when we looked at the papers that unpicked co-worker perceptions of work adjustments, we found that co-workers see flexible hours and time off for counselling as much more acceptable than somebody having more frequent breaks. And so that gives us some really interesting insights where we need to educate our colleagues about the importance of frequent breaks and the importance of respite for those people who are returning, because that can help them sustain a full day or a full week of work. And from an employer and HR perspective, we can see that the guidance and the research there really focuses on the work aspects, so the job modifications that are made. Well, employees tend to, in their reports of work adjustments, they focus on the relational aspects. So the support they've been afforded, their good working relationships. So we can see that people are focusing on slightly different things and perhaps prioritizing different things in that return to work and work adjustment process. We found no evidence for the differences in adjustments recommended or accessed relating to the severity of mental health. For example, the differences between transitory everyday anxiety or severe mental ill health conditions. We also didn't see any difference in the recommendations between those people who are being offered at work while they're at work to prevent a period of absence or at the period of return. We didn't see any difference between those recommended under the Equality Act or those that fall outside it, or between those that are recommended by occupational health, human resources, or supervisors. So different disciplines seem to be saying the same thing. And we found, as I was mentioning, no effectiveness for the adjustments as measured by longitudinal control studies. So that's really where we could direct efforts to fully understand what's going on and which components are most effective. So what does this mean? We've got a wide range of adjustments being recommended and accessed in the workplace, but we don't yet have a clear understanding of who's accessing what, for how long they're accessing it, and with what effect on mental health or workability. There's need for a much more granular understanding of effectiveness so that we can steer guidance by role, by sector, and by adjustment. And this would give both health professionals and employees and employers much more directive insights into what might work for them. So there's need to develop guidance that really brings together the current evidence that we have, and particularly focuses on employees to empower them to make better decisions and to ask for different things. So thank you ever so much. There's a link to the report there and also some further insights on our website. Thank you.
That was great. Thanks for joining, Jo. I have a question for you from Louise. Based on the evidence that you found, was the research actually broken down in terms of data based on, for example, the size of the organisation and sector, and were SMEs covered? Did it go into that kind of granular detail?
They're really great questions, and no, it didn't. It'd be wonderful if it did, but it was very broad in its approach. And I think one of the things that we certainly struggle with in the UK, and I think elsewhere, is having data from people working in SMEs is really challenging to gather, largely because they often don't use occupational health services, and that's often the place that data comes from. And as Margot was suggesting, there's a very different system that they're able to draw their data from in the Netherlands. And so without that, in many other countries, we often have the data slipping through the gaps, and we don't see it being collected.
Okay, thank you. All right, just so we can keep to time, and we are going to revisit all the questions that are coming in at the end. If we can then move on to the next presentation, it's going to be by Margot, and she's going to be giving some details on the workers' perspective from a qualitative study on barriers and facilitators for the return to work. Okay, if we can have Margot's second presentation, please.
So in this second presentation, I want to focus on barriers and facilitators for return to work, and then looking at that from a worker's perspective. So this study was also financed by IOSH. And so in my previous presentation, I was talking about research that we've done with quantitative data. And in this presentation, I want to focus on a study where we wanted to gain more insight in the return to work process, but then using a qualitative approach. So here we interviewed workers that were on sick leave with mental health problems. So we wanted to learn more about the perspective of the workers themselves. So we we used interview study using face-to-face interviews, and we interviewed workers at 2 moments in time. So the first interview was done at the start of their sickness absence, and then we stayed in contact with these workers, and then the second interview was done when they resumed work or after 6 months if the worker was still on sick leave. So this interview study was also conducted in the Netherlands, so we have this Dutch context again. So in the interviews, there were 2 main questions that we focused on. So first was, what were the factors leading to your sickness absence? And the second was, what are barriers and facilitating factors for your return to work? So because we had this design of these 2 interview moments in time, 3 subgroups emerged. So we had a group of workers that were on short-term sick leave. They were returned to work within 3 months. We had a group on medium-term sick leave between 3 and 6 months. And we had a group with a long-term sick leave. So they stayed at home for 6 months or longer. So there were many things said by these workers, but we were focused on 5 main topics that emerged. So first of all, almost all workers, they mentioned that they perceived a high workload, and that this was one of the primary causes of their sickness absence. And what they mentioned was that actually there were characteristics in the work environment that were actually was actually a high workload, such as tight deadlines, working over hours. But at the same time, they said that this workload was often self-imposed. So they felt really responsible, and they had a high perfectionism. So it's important to see that they mentioned high workload, but they said it's actual workload, but it's also self-imposed workload that is important in causing sickness absence. So a recurrent theme in the interviews was that workers said that they lacked self-evaluation. They said that they didn't really realize how they were functioning prior to the sickness absence. And also that there were signals, but they were often ignored. So they said they lacked skills. And they also mentioned that gaining self-awareness is really a crucial element in return to work. Also help in learning to set limits, to be more assertive, to say no to specific tasks was a facilitating factor in returning to work. So what we found interesting was that although workers mentioned they had mental health conditions and had often more symptoms, these were not really regarded as the cause of the sickness absence. So the mental health problems were more seen as consequences and not really as the cause of sickness absence. And we think that this shows or suggests that it's not the condition itself, but non-disease related factors that play a role in sickness absence. And we should focus more on that. So a 4th theme was the importance of a successful manager, for a supportive manager for the successful return to work. So most workers mentioned that they didn't really feel heard by their manager. And what they said is they wanted the manager to listen to them and to show support. But they also said that there's a thin line between showing interest and putting pressure, because they didn't want to feel pressure to return to work. A manager that would call to ask how someone's doing, he might think that he shows interest, but it can also be perceived as putting pressure to return to work. So workers agreed that what they needed was a personalized guidance, and what they need from their manager was to listen to them and really focus on their needs in the return to work process. So we also, because we had these 3 subgroups, we also looked at what maybe can we see differences between these 3 subgroups. And we found 2 main differences between the short-term people with short-term sick leave and long-term sick leave. And the first had to do with the ability to regain control. So what we saw is that workers on sick leave, short-term sick leave, they seem to be more proactive and they seem to be more engaged in recovery enhancing behavior, such as maintaining their daily structure, doing physical activity. Whereas the workers on long-term sick leave, they seem to be more in need of professional help, and they seem to be more in need and to receive help in regaining control again. So another difference in my final finding is had to do with the importance of the value of work. So what we saw is that people on long-term sick leave, they often mentioned that they were dissatisfied with their work. They were dissatisfied with their job content. And we saw actually that there was a mismatch between the person and the job. This is one quote of a worker in our interview on long-term sick leave. So she says, I could return to where I am now, but then dissatisfaction would come up again. And that is, of course, one of the factors that is why this happens, that is not going well. And I don't have to be supported so much. It's about that I don't like the job. So here we see that the dissatisfaction is one of the causes of the sickness absence, and it's also not really helpful in returning to the job. And I also have here a quote of a person that's on short-term sick leave, and where you can see what the value of work, why is this important. So we asked this person, what made the return to work easier? And he said, well, it's because I felt connected with my job. I like my job. I have affinity with my work, with the people on my job, and I get respected as a person, yes. So we think that actually this value of work is a very important topic to discuss prior to the sickness absence and also during return to work. So what are the conclusions from this interview study? So when looking at what the workers mentioned in these three subgroups, we see mostly similarities between the subgroups. Interestingly, mental health disorders were not really seen as the main cause of sickness absence. So we think that in preventing sickness absence, we should focus more on non-disease specific aspects. What workers mentioned was that decreasing the perceived workload is important. So not only the actual workload, but also the perceived workload. And that increasing self-reflection seems to be important in the return to work process. And finally, from this study, we learned from the importance of the value of one's work. And we think that this should get more attention at the workplace. So I want to conclude with three recommendations for practice. So first of all, we think that it's important to improve managers' knowledge and skills in guiding workers with mental health problems. We also think that in supporting workers in the return to work process, it's important to gain self-awareness and regaining control. And this is something that is important for occupational health professionals and psychologists, but also important for managers to pay attention to. And finally, a personalized return to work support is needed, and we should do that by focusing on the values, views, and needs of each individual worker. So I want to thank you again for your attention, and thank you.
Thank you, Margot, for sharing that. So we've got a couple of questions for you. The first is from Catherine. If someone's off sick and the cause is classed as stress, would it be better for the company to get a counsellor, so someone external to the company involved, to actually help this person?
So thank you for that question. No, actually, I think it's better to have a counselor, to have guidance, but someone who is familiar with the workplace, because we know also from research that the interventions that are most successful in return to work interventions are those that have a work-focused component. So I think we should not, of course, when someone has mental health issues, these people should be treated and get good medical care, mental health care, but there should always be a guidance that is linked to the workplace, I believe.
Okay, thank you. And a question from someone else who's asking, would scheduling team meetings to discuss employees' problems and frustrations or difficulties, would that be useful to help make employees feel that they're heard? And what would be the best ratio for those kind of meetings? What's your thoughts?
Well, I think it's an excellent suggestion to have team meetings, schedule those team meetings on a regular basis. I would only not focus so much on frustrations and on problems, but I would suggest to have to focus in these meetings on the positive. So on what do people find important in their work? What are their work values? And how can the work environment help to realize those values for these employees? I would suggest this. And on what the second question was, what was the, what based on?
Yeah, what ratio, like how often those types of meetings?
I think that's difficult to say. That depends also on the group size and all those kinds of things.
Okay, thank you.
Positive is actually one of my main advice.
Right, okay, thank you, Margot. Karen has, she's got some thoughts in terms of the terminology that we use. So she doesn't like the phrase or the terminology when we're referring to mental health problems. Mm-hmm. Why is it a problem? So what's your thoughts on that?
Well, yeah, I think we should pay more attention to mental health in general, and of course also preventing problems. So I'm not sure why what exactly is what she doesn't like, but we often use the word mental health problems because it's such a broad broad theme, and people can have all kinds of issues that are covered in that terminology. But talking about mental health would be maybe.
Okay, thank you. Another question before we move on to in terms of the order of the programme. Do you recommend that internal training is undertaken, such as a training that's focused on mental health, so that the personal relationships which have been built up between colleagues can be better utilised rather than an external consultant being used? So yeah, did that make sense?
Yes, yeah, and I think, yes, one of my conclusions or recommendations is that I think, and it's also something that Jo touched on in her presentation, that managers often don't really know how to react, how to guide workers that are on sick leave. So I think it would be really interesting, yes, to have internal training sessions, but I would also then focus not so much on the mental health problem, as the previous panelist said. Well, not so much focus on the problem, but more on mental health topic in general.
Okay, and just to clarify, I think that perhaps it was more about the type of intervention. So an internal training that's taken place where you're training others to support colleagues in mental health.
Oh, yes. Yeah. It's like a buddy system.
Yeah, so for, yeah.
Yeah, well, that could also be interesting, yes. Yeah.
Okay. All right, thank you. So if we can move now on to the final presentation of today's session, which is going to be delivered by Jo once again. So this is going to, Jo's presentation is going to be introducing the IGLOO model for sustainable return to work, exploring the role of individuals, groups, line managers and organisations. So let's have Jo's presentation before we then come back to have another session of questions and answers.
In this session, I'm going to be talking about a project that looked at the resources required to support returning employees when they had returned from a period of absence following mental ill health. And this work was led by Professor Karina Nielsen at the University of Sheffield. And what we aimed to do was to really understand all of those resources at igloo level. So looking at the individual, the group, the line manager, and the organizational levels that are required to help that individual sustain work when they got back. The reason that we completed this project was really to try and understand what people needed to do and address some of these key problems that Margot has been talking about earlier today, that Evelyn has talked about in relation to disclosure and the challenges that people face once they've disclosed. And we know that too many people struggle to return. The statistics in the UK, we have 1 in 3 fit notes are related to mental health, and that was pre-pandemic. With the incidents that we hear from Mind in terms of rising levels of reported mental health, and also those individuals that had concerns before are experiencing depleted mental health, we know that this is something we really need to attend to. And so our research question was, what are the resources that people need to return to and stay at work following mental health sickness absence? And so what we did was we interviewed 38 employees and 20 managers at multiple time points over a 4-month period. So we wanted to know what helped people over that period of time. And we used our recently developed framework that we've published previously to really try to understand what is it that an employee needs to do, that the manager needs to do, that their colleagues need to do to build up this protective igloo. And here's a very short summary of our findings. So you can see that people reported having resources that they drew from in the home environment, as well as resources that they drew from in the work environment. And this is quite unique because often when we look at return to work research, it's very siloed in our approach. So typically we look at the individual level, occasionally we look at the group or the leader level, but we certainly don't integrate what goes on at home and what goes on in the workplace. And that is a really important thing to consider, particularly if we know that people perhaps have gaps in provision, either at home or at work. We could booster the access to resource that they have either in work or home to compensate. So at the individual level, some of the things that employees talked about was prioritizing self-care. So those individuals that stayed at work over that 4-month period and reported better mental well-being were those that made sure that they had very clear boundaries between work and home. They kept prioritizing self-care, so thinking about the small rituals that really help them to stay well, keeping up with appointments for therapy, making sure that they took exercise or went for a walk or did some yoga, making sure that they looked after themselves as well and scheduled that into their day. In the work environment, it was very much around creating structure, having very small tasks broken down so that they can see what needs to be done next, but without feeling overwhelmed by the enormity of a day. At the group level, people reported the understanding from others really important. So having conversations where friends and colleagues were listening and essentially giving them non-judgmental support. So being treated as somebody they were before, not somebody who's got mental ill health. And this was absolutely key, as well as receiving feedback on tasks from colleagues. So when you've done a good job, letting somebody know that they've done a good job, and also offering to help out if that's a challenging task. So whether it's somebody sitting in a call center, if you know that there's a particular type of call that's really challenging and you overhear a colleague working on it, after the call, give them some feedback and let them know that that you're listening out for them. If somebody's done a really good job in their day-to-day tasks, letting them know. Often we go on through our day and we expect a good job and we reprimand people when they don't do well, but actually small positive feedback steps throughout the day can be really beneficial to those people who are returning to work. It can help boost their confidence. At the line manager level, we found in the workplace, having a very clear framework to agree how the individual is going to be communicated with and how their return is going to be communicated to the rest of the team is really important. So making sure that there's a mutual understanding between the employee and the line manager about what is said about their absence and their return. also making sure that there's not just support, but there's continued support, not just in the first day or the first week, but that goes on over a period of time. And line managers who are there and available, but not intrusive and micromanaging is the most appropriate balance. So continually checking in to see if everything's okay and monitoring progress, but not micromanaging, and giving that individual a little bit of freedom to manage their work in the way that is best fit for their health. Outside the work environment, we found that at the leader level, having a consistent point of contact is really important. So here, this is about the leader who links into the range of services that might be available. So having a link to therapy, having a consistent GP point. And this is where that compensation is really vital. So we know that many people struggle to access services outside of work. We know that many people have different GPs from session to session. So having a really consistent point of contact from a line manager can be really beneficial. Also at the organisational level, we know that having access to work-focused counselling outside of work can be key to helping people progress. We recently did a review for ACAS looking at mental health work adjustments, and all of the evidence pointed towards when work-focused counselling is offered in combination with other adjustments, it's much more beneficial for the employee. So this is thinking about having therapy to address anxiety or depression, but also work-focused counselling to think about how you talk about workplace issues. In the work environment, organisations that have flexible working practices and strong leave policies were found to be helpful, and they allowed people to manage their condition as they returned in a fluctuating way. Also, making sure that we demonstrate care through support. So offering access to support, ensuring that the individual is equipped with the skills and resources that they need to return, whether that's something from HR or from occupational health or health and safety. And then also thinking about the more cultural issues. So what is the organisation doing to really support and embed a culture of mental health, where mental health is not stigmatised and this whole spectrum of mental health is embraced, where we recognise that people's mental health fluctuates from thriving to struggle, and we need a constant dialogue to be open and supportive about that. So with this project, we've developed a range of different practical resources, and it really brings together, I think, a number of the things that we've been talking about this morning in terms of how we can support people with fluctuating patterns of absence and illness, how we can provide a platform for discussion to enhance disclosure where that's appropriate, and how we can think about some of the contextual issues that will really support the implementation of work adjustments. And so these practical resources are available in different mirrored guidance so that everybody can have something that's very relevant to them and their role in the process, but from a shared perspective. So the implications of this is really that there's an urgent call for action. The impact of the pandemic on mental health across the globe means that it's no longer a problem that we can ignore and no longer a problem that we can overlook. Individuals need to be equipped with the knowledge and the support to sustain their own mental health on their return, but they can't do it on their own. And so groups, line managers and organisations, and also those overarching government and social structures have a really significant role to play. And we need to do more evaluation. So we need evaluating approaches that look long term, particularly in the UK, where we have very little data that really gives us an understanding of what's going on. And therefore we have little understanding really of what works for whom and under what circumstances. And without that, we can't make good decisions. And finally, we need to remember that it all starts with prevention and good work. If we have preventative approaches in place at the beginning, and we have good work that individuals leave and can come back to following return, then we know that that return is much more likely to be something that is successful for the individual and also the organisation. So to find out more about this in this research, you can find a report and some more information on the Productivity Insights Network site, which is the funding body for this research, and also on our Affinities site. And there's the reference to the academic paper if you're interested in reading that. So thank you ever so much.
That was great. Thank you, Jo. Okay, before I ask Margot and Evelyn to join us, I think you touched on this in your presentation. What are the attributes of work-focused mental health care interventions? What would you say are the key attributes?
So I think we need to think in terms of a matrix, really. So thinking about the whole system, so what we can do for the individual, for groups to educate and upskill, for line managers, and also all of the different key players within the organization that oversee those systems. So often we find that there are different communication routes, different rules, different perspectives from health and safety, from occupational health, from HR, and thinking about how we bring all of those different perspectives together. So that's one part, but also I think thinking about prevention, so risk assessment. I know that IOSH has been a big supporter of the forthcoming ISO that's looking at psychosocial work conditions. And in the UK, we have the management standards. Across different countries, you have other frameworks for looking at work stress and working conditions. And I think for me, that's absolutely the place to start, because if we don't have those good working conditions, as Margot was mentioning, that if you don't want to come back to work, it's going to be very difficult to come back to work. So having those good working conditions in place in the first place. So preventative approaches that risk assess and change. Also development, so focusing on what we can do not only to raise awareness, but also change behaviour. And I think typically what we see is a lot of interventions at the moment have been oriented at raising awareness. And I think looking at how we really embed and develop and change behaviour is vital. So we look at that change and an ongoing change within the workplace. And then finally, having those work-focused supports for individuals who are hoping to return or need to rehabilitate. So I think it was Evelyn mentioned talking about how you want to disclose and practicing. And that's certainly something in our work that we talk about a lot. Often people have really, really important conversations without practicing it first, and nothing comes out right the first time, or very rarely it does. And so giving people the opportunity to rehearse and practice what they want to say, so that at the point where it's important, when they're talking to line managers or colleagues or clients, they're much better able to do that.
Thank you. Okay, so with the remaining time that we have, can I ask Margot and Evelyn to join us? All right. We have a question, and I'm going back to the ones that we missed earlier. So this is, I think this one really is for you, Margot. Based on your research and understanding that each case is an individual, is there a best way, inverted commas best, to return to work?
Well, actually, from our research, with a large data set, we cannot really say that there's one best way. So I think, and it has been said before, it's really, we should really focus on a personalized approach. So looking at what the person really needs, what their values are, and find the best fitted guidance for that.
Okay, and another one for you from Daniel. It seemed that a gradual return was successful in some cases, and a swift return had success, but also drawbacks based on the graphical data. Mm-hmm. Was this difference mainly down to the age ranges of the persons involved?
So we saw differences in age between the faster and the slower trajectories. Yes, but we, so this is one variable that we looked into, and then we have some other variables. So I don't want to suggest that it's only age that is of relevance here. There are so many other variables that we did not put in our model, that we did not have access to, and I think would be really interesting to look into those aspects further, and I think that those are also mentioned in the other presentations. I think we should more focus on communication between the employee and the employer, and also aligning treatment advice between different healthcare providers and occupational health and safety providers.
Thank you. And can I bring you in, Evelyn? So this one is someone shared that personally, as a job seeker with a mental health history, they're finding that as soon as they mention mental health issues, they can almost hear that their application is going to go through the shredder. Can you suggest ways of crossing that like 3-year gap without this type of reaction?
Yeah, so in other words, you're asking for advice how to deal with it.
Yeah, yes, yeah.
Well, again, there's no one size fits all advice, because it depends on many factors, and it depends on the person who's in front, who's interviewing you. It depends on you, what you want to say and what you want to disclose. Obviously, it depends on whether you have visible symptoms. If you do have them, what we found in our studies that especially employers said, if we see visible symptoms, we'd rather hear something about it than think, nothing is being said to what's going on with this person, so they want to understand rather than be guessing. Also, if you disclose during the job interview, you might be able to, if you get a good reaction, you might be able to ask for certain work adjustments that are essential to keep the job. So there are advantages, and also sometimes you have to disclose because there's a gap in your CV, and you haven't been working for a year or so, and you need to explain that. But other than that, so it can really depend on the situation, but the main message is think this through very carefully, discuss it with other people around you, and also what we found in our studies that especially the stakeholder groups of people with mental health problems themselves, and especially the mental health advocates, were underestimating the discrimination risk, or they were, because they were so much emphasizing on the authenticity aspect. So they said, I don't want to work for an employer who doesn't accept me, so I'll just be open. And you might think that way, but it is something to consider whether or not you want a job. Then you might have to be more careful in what you say, or think it through better.
Thank you, and I think that answers another question around that area. So if I can come back to, I think this is a question really for all of you. So if we start with Jo first, how much influence do you think that the current high volume of media exposure has affected the incidence of absenteeism due to mental health issues? So how much influence do you think that the high volume of media
I think
has
it's really
affected?
interesting. I was looking earlier at some statistics from the Health and Safety Executive, and they show that over the last few months, the incidence in mental health, ill health reporting has gone up. And I suppose I'm quite interested to know whether that's people feeling more confident to disclose, because the conversation around mental health has become much more fluid, and many organisations are tackling it head on, which is wonderful. So whether incidence has increased significantly, or whether confidence in disclosing has increased, will be really interesting to see over time. I think one of the other things to keep in mind is that this period has been incredibly difficult for many different groups of people, and so it's likely that the pandemic has increased, particularly because we know that many of the key contributors to protecting our mental health, like social connections, like being able to get out and about and take notice and see see the natural environment and do our exercise. All of those things have been restricted for many people across the globe. So we know that our natural protections have been depleted over the last while.
Thank you. Margot, Evelyn, if you've got anything else to add to what Jo said.
Go ahead.
Not really, but Evelyn.
Okay. Okay, I can move to the next question. So I think this is a really good one, and I think it's kind of been covered, but it is basically what happens in reality. So, but what can be done to address toxic working conditions? So it's the culture, it's that toxic environment that's affecting and having an impact on the individuals. So what can be done to address toxic working conditions? How can they be identified, and who should be responsible for correcting them?
It's a difficult question, isn't it?
It is.
Well, I think it's important that employers start to realize more that by creating inclusive workplaces, people will also feel better and be more productive, and turnover will, there will be less turnover, and so it will benefit them all. And it's interesting that in our study, the employees and the HR managers were the only ones who did not address the advantages of an inclusive workforce, whereas the other groups did. I think, as an answer to your question, I'm not sure. Maybe if a company is doing financially well, they don't have. Maybe economic reasons can force a company to be looking into workers' well-being and creating a better workplace. I'm not sure.
Okay, Jo?
I was going to say, I think one of the things that this talks to, which health and safety particularly have a role to play, is looking at the risk assessment approach and how that links to risk assessing, so that individuals who don't feel confident coming forward about their toxic team or their toxic line manager have an opportunity to share that. And also within that risk assessment process, there is, once that has been identified, there is hopefully a system in place whereby there is a facilitated discussion around how that can come forward. And we do quite a lot of work with teams and departments to look at how do we have different conversations, and what is it that's underpinning that toxic work environment. And often it's something that has started off and just spiraled out of control. So in one team we were working with, it was actually that the key person who was the antagonist just talked to her emails all the time. And just so every email came in, she was angry at it, and it just filtered out this horrible environment around the team. And so a risk assessment approach can allow you to get to the bottom of some of these things that are often not what you see at the surface level as well.
Thank you, Jo. We have run out of time actually. So I think we're going to have to draw it to a close at the moment, sadly. So if we can just draw it to an end, I think it's been really interesting. There's been quite a few questions coming through, which just shows how engaging our audience has found this, and how interesting or how important the topic is. I'm just left really just to thank you, Jo, yourself, Margot, and Evelyn, for your time and joining us as panelists. And I want to thank you, the audience, for attending today. Please do enjoy the rest of your day or your evening, and stay safe. Thank you.